Your doctor just prescribed you Ozempic. You're thrilled. You've seen the transformations, the celebrities, the before and afters, 20 pounds in 2 months, 30 pounds in 3. But here's what they didn't tell you in that 15-minute appointment. Your stomach is about to stop working. Your muscles are going to waste away with the fat. And when you stop taking it, and you will stop because you can't stay on it forever, you'll gain it all back, plus more. Because this drug didn't fix your hunger, it just silenced it. And when the silence ends, your brain will scream for food louder than ever before. I'm about to show you what's really happening inside your body on these GLP-1 drugs and why the doctors prescribing them are worried about what we're going to see in 5 years. I'm about to show you what's really happening inside your body on these GLP-1 drugs and why the doctors prescribing them are worried about what we're going to see in 5 years. When you eat, your intestines release GLP-1. It travels to your pancreas and tells it to make insulin. It travels to your brain and tells you you're full. It travels to your stomach and tells it to slow down. It's your body's natural stop eating signal. These drugs are synthetic versions of that hormone, but they're not the same. Natural GLP-1 lasts about 2 minutes in your body. 2 minutes. Then it breaks down and disappears. Ozempic, it lasts a week, because they modified the molecule so your body can't break it down. You're flooding your system with a hormone that's supposed to be there for minutes, but now it's there for days. And this creates effects your body was never designed to handle. Your stomach doesn't just slow down, it nearly stops. Food sits there for hours, 4, 6, 8 hours, just sitting, fermenting. This is called gastroparesis, stomach paralysis, and it's not a rare side effect. Studies show it happens to up to 40% of users. 40%, nearly half of people taking these drugs develop a partially paralyzed stomach. You know that constant nausea people complain about? That I can't eat feeling? That's not the drug working as intended. That's your stomach failing to do its job. Food is literally rotting in your stomach because it can't move through your system. And your brain? The GLP-1 receptors in your brain are being hammered 24/7. You don't just feel less hungry, you feel nothing. Food becomes repulsive. The thought of eating makes you sick. Some people can barely manage 500 calories a day. Doctors are calling this food noise reduction. But let's be honest, this isn't reducing noise. This is unplugging your hunger system entirely. Your brain's survival instinct to eat is being chemically overridden. Let's talk about what's actually happening to people's bodies. Because the drug companies show you the weight loss, they don't show you what you're losing along with the fat. Studies show that 40% of the weight lost on Ozempic is muscle, not fat. Muscle. You're losing the tissue that keeps you strong, maintains your metabolism, and protects your bones. A woman loses 30 pounds on Ozempic. Sounds great, right? Except 12 of those pounds are muscle. Her metabolism has dropped. Her bone density is decreasing. She's weaker. And when she stops the drug and the weight comes back, it comes back as fat, pure fat. So she ends up the same weight she started, but with less muscle and more fat. Her body composition is actually worse than before she started. Then there's pancreatitis. Your pancreas gets inflamed, swells up, and in severe cases starts digesting itself. It's excruciating, and the risk is 4 times higher on GLP-1 drugs compared to other diabetes medications. Gallstones. Rapid weight loss causes your liver to dump cholesterol into your gallbladder faster than it can process. Stones form. You end up in surgery getting your gallbladder removed. This is happening so frequently that surgeons are calling it Ozempic gallbladder. And let's talk about what nobody wants to discuss, Ozempic face. You lose weight so fast that your face can't keep up. The fat pads in your face that keep you looking youthful disappear. Your skin sags. You look gaunt, hollow, aged. People are losing 50 pounds and looking 10 years older. So now they're getting fillers to replace the facial fat they lost. We're creating a cycle where you take a drug to lose weight, then need cosmetic procedures to fix what the drug did to your face. But here's the one that should terrify you: thyroid cancer. The animal studies showed increased rates of thyroid tumors. Now we're seeing signals in human data. The FDA put a black box warning on these drugs, the strongest warning they can issue. And we don't know the long-term risk because these drugs haven't been used long-term for weight loss. Ozempic was approved for weight loss in 2021. We have 3 years of data. 3 years. What happens at year 5, year 10? Nobody knows. We're running a massive experiment on millions of people, and we won't know the full results for decades. Now, let's talk about what happens when you stop, because you will stop. Either because of side effects, because of cost, these drugs run $1,000 a month without insurance, or because your doctor takes you off them. And when you stop, your body doesn't just go back to normal, it rebounds hard. Remember, Ozempic didn't teach you how to eat less. It didn't fix your relationship with food. It didn't address why you gained weight in the first place. It just chemically suppressed your hunger. Studies on people who stopped GLP-1 drugs show that within 1 year, they regained 2/3 of the weight they lost. 2/3. And many gained back more than they lost. Your metabolism has been suppressed for months. You've lost significant muscle mass. Your body is in starvation mode, convinced it just survived a famine. So when food becomes available again, when you can finally eat without nausea, your body hoards every calorie. And your hunger, it's not just back, it's amplified. Your brain spent months being told no food, no food, no food. Now that signal is gone and your brain is screaming, eat everything now. This is called hyperphagia, excessive hunger that's almost impossible to control. People describe it as being ravenously hungry 24/7. They're eating massive amounts and still feeling unsatisfied. Let me show you a real pattern. Woman, age 38, lost 45 pounds on Ozempic over 8 months. She felt sick the entire time but loved the results. She stopped because she couldn't handle the side effects anymore. Within 14 months of stopping, she'd gained back 60 pounds. 60. She ended up 15 pounds heavier than when she started, with less muscle and a slower metabolism. And this is what the drug companies don't tell you. They show you the 12-month weight loss results in their glossy brochures. They don't show you the 24-month weight regain results, because they don't want you to know that this isn't a solution. It's a temporary band-aid. Your doctor might say just stay on it indefinitely, but we don't know if that's safe. We don't know what happens to your stomach after 5 years of being partially paralyzed. We don't know what happens to your thyroid. We don't know what happens to your brain's hunger regulation when it's been suppressed for years. We're running a massive experiment, and millions of people are the test subjects. Here's the truth. GLP-1 drugs were developed for type 2 diabetics with severe obesity, people whose blood sugar was out of control and whose weight was actively killing them. For these patients, the benefits can genuinely outweigh the risks. If you're 100 pounds overweight with diabetes, heart disease, and high blood pressure, losing 50 pounds on Ozempic could save your life, even with the side effects. The immediate benefit of reducing your cardiovascular risk and controlling your blood sugar outweighs the potential long-term unknowns. But that's not who's taking these drugs now. Recent data shows that half the people on Ozempic have a BMI under 30. They're not obese, they're not diabetic, they're people who want to lose 15 or 20 pounds for cosmetic reasons. And for these people, the risk-benefit calculation is completely different. You're exposing yourself to gastroparesis, muscle loss, potential thyroid cancer, and guaranteed weight regain to lose 15 pounds that you could lose through literally any other method. This is the reality doctors face every day. Patients come in demanding these drugs. They see the results on social media. Their friends lost weight. Celebrities are obviously using them, and they don't want to hear about risks or alternatives. But here's what needs to be said. These drugs don't address the fundamental issue. Why do you overeat? Is it stress, emotional eating, boredom, poor food environment, lack of sleep affecting your hunger hormones, undiagnosed depression or anxiety? Ozempic doesn't fix any of that. It just covers it up with chemical appetite suppression. So when the drug stops, all those underlying issues are still there. You still stress eat. You still use food for emotional comfort. You still live in an environment that encourages overeating. And now you're starting from a worse position because you've lost muscle, damaged your metabolism, and trained your body to expect famine followed by feast. Now, I'm going to tell you what actually works for lasting weight loss. And you're not going to want to hear it because it's not quick, it's not magic, and nobody's making billions of dollars selling it to you. Protein. Eating more protein naturally increases GLP-1 production in your gut. Your body produces it when you consume protein-rich foods. Not as much as injecting synthetic hormones, obviously, but enough to significantly reduce hunger and increase satiety. Studies show that people who eat 30% of their calories from protein naturally eat 400 to 500 fewer calories per day without trying. That's 3 to 4 pounds of fat loss per month. Sustainable, no nausea, no muscle loss, actually building muscle while losing fat. Resistance training, lifting weights, building muscle. Every pound of muscle you add burns an extra 6 to 10 calories per day at rest. But more importantly, it prevents the metabolic adaptation that makes regaining weight so easy. When you lose weight through diet alone or through Ozempic, your metabolism drops. When you lose weight while building muscle, your metabolism stays strong or even increases.
Sleep. 7 to 9 hours every night. When you're sleep deprived, your hunger hormones go completely haywire. Ghrelin spikes, that's your hunger hormone. Leptin drops, that's your fullness hormone. You're biologically driven to eat 300 to 500 more calories per day. Fixing your sleep can reduce hunger by 20 to 30%. That's huge, and it's free, and it doesn't give you gastroparesis or thyroid tumors. Stress management. Chronic stress increases cortisol, which directly increases belly fat storage and drives cravings for high-calorie comfort foods. You can't out-Ozempic a stress-eating problem. You have to actually address the stress at its source. And here's the thing. All of these approaches work together synergistically. Better sleep improves your workout performance and reduces stress. More protein helps you build muscle and stay full. Lower stress improves your sleep quality. You're creating an upward spiral instead of depending on a drug. But this takes time, 3 months, 6 months, a year, not 8 weeks like Ozempic promises. And that's exactly why people don't want to do it. We've been sold the idea that fast results are the only results worth pursuing. But fast results fade fast. Slow results last forever.
So here's the question you need to ask yourself. Are you willing to risk permanent stomach damage, accelerated muscle loss, facial aging, and potential thyroid cancer to lose weight 6 months faster than you could do it naturally? Because that's really the trade. Ozempic doesn't help you lose more weight than you could lose on your own. It just helps you lose it faster. And then you gain it back faster too. And more importantly, what happens when you stop? Because you will stop eventually. Will you have learned anything? Will you have built any sustainable habits? Or will you just be back where you started, but with less muscle, a slower metabolism, and a stretched out stomach that doesn't work properly? I'm not saying these drugs don't have a place in medicine. For someone who's severely obese with multiple health complications and has tried everything else, GLP-1s might be the intervention that saves their life and gives them the jumpstart they need to build healthy habits. But for the majority of people taking them right now, they're a shortcut that leads to a dead end. Your doctor prescribed it because you asked for it, because they have 15 minutes per patient, and it's easier to write a prescription than to have a difficult conversation about behavior change, emotional eating, stress management, and the hard work of sustainable weight loss. But easy isn't the same as right, and fast isn't the same as lasting, and medicating a behavior problem doesn't solve the behavior problem.
You want to lose weight and keep it off? Here's the formula. Eat 30% protein, lift weights 3 times a week, sleep 8 hours every night, walk 10,000 steps daily, manage your stress. Do this consistently for 6 months and you'll lose 20-30 pounds of actual fat while building muscle and fixing your metabolism. And you'll keep it off because you'll have built sustainable habits. You'll have addressed the root causes and you won't have destroyed your stomach or risked cancer in the process. Or take the Ozempic, lose it in 8 weeks, feel sick the whole time, watch your face age, lose your muscle, pay $12,000 a year, then gain it all back plus more when you stop. The choice is entirely yours, but now you know what your doctor wasn't telling you, and you can't unknow it. Fast results fade fast. Slow results last. Want the complete science-backed guide to sustainable weight loss? Link in description. Comment sustainable if you're choosing the long-term path. Share this with someone considering Ozempic. They need to know the full story. Subscribe for more health truth that could change your life.